Hi, my name is Karen Banuelos, and today I'm gonna record a video for our last class, acute care 593 and 94. So first of all, I want to say that I'm super happy because we're almost done. 2 more classes to go and we can finally say we're F in peace. So the key components for this course, I would like to say that it was the treatment of the acute care patients and the diagnosing of them. I think it's really important to state that with the other classes we've been evolving on what an FNP does and the scope of practice, and to follow the standardized procedures that we're allowed to follow, and advancing from the RN to the FNP. I mean, we're still RNs, but now our scope of practice is a little bit more in depth, I want to say. So when we did the health assessment, it was focused more on the assessment of the patient, and then we continued to other classes. And now that we're in the acute care, what I learned is that it is a little bit more aggressive when we treat in the acute care setting, because we want to make sure that we are assessing them correctly and following up, getting all the information needed to diagnose the patient. And I think it's really important to make sure we understand that in order for us to treat a patient in the acute care setting, it is important to know what we're treating. So I think that's one of the most important key components of the acute care that we gotta know, because we're family nurse practitioners. The key components of some of the signs and symptoms for the different spectrum of life, including OB, pediatrics, geriatrics, and how they would look in the clinical, and how their signs and symptoms would be demonstrated, and then know how to treat them respectively. How would this class would help me implement the skills that I've learned to my practice? Well, sometimes I think I'm gonna start working with an internist, an internal medicine doctor. I think, hopefully everything goes well. And in that setting, we would think that it's just more of the follow-up and managing chronic conditions. But really, many times we get patients that are sick and need treatment, and more in the acute care aspect. For example, you have your very ill patients that have hypertension, diabetes, uncontrolled diabetes, some sort of diabetic peripheral neuropathy. Maybe they are presenting to your clinic with diabetic foot, and it is in the acute aspect. So how would you treat it? So the skills that I've learned in this class have helped me identify what needs to be done first, what's more important for the patient, so the patient doesn't suffer as much, and then we can save the patient from staying in the clinic or the hospital. Another thing, so the challenges during this course, well, as we all know, this is a very intense course since it's only 8 weeks, and we have to do our practicum, we have to study and all that. So that's always a challenge, but I think the most important thing is to understand the difference between what we can treat in the clinical setting, in the primary care office, whether the patient needs to be transferred, referred to ER, when it's okay to treat at home, and when we need to refer. To me, at least, that was a challenge, because there are certain patients that I wasn't completely sure what the best course of action would have been for them. In my professional experience, I had a different perspective of what the patient should have done. So learning that each provider has different experiences, different thoughts, and because of that, they have different approaches. So I think it's important. Well, to me, the challenge was that from my experience, my perspective, I would have done something differently, which is not wrong, but we just have to make sure I read and educate myself as much as possible and follow the standardized procedures for each individual case, and to ask questions as needed to determine what's the best course of action for the patient presenting with acute care symptoms or diagnoses. My two thoughts for this course is that I think so. During this course, ever since we started the program, it's been a development of our skills and a learning process. And I think at this point, since we're so close to graduating and we're being exposed to so many different settings, we can really appreciate more what being a family nurse practitioner means. And my two thoughts is that every time I experience more of this, I like it even more. It is a difficult task, I think, to conquer, to learn everything, because we're family nurse practitioners. I think that makes it a little bit more difficult because our spectrum is a little bit more broad. We see from very tiny little babies to very sick and older people. So I think that makes it challenging, but I like it. I like the challenge. That's it for this course. I really enjoyed it, and I love that we have Dr. Ramira as our instructor. I think she's a very educated person, and I learned a lot from her, and I don't think there's anything else I would have done different. Thank you.